We mentioned earlier about the testing and research that we do. In addition to our 24-year experiential track of results and what works and what doesn't, we also want to look at the other side of the coin, and that would be, of course, the dental consumer. And what do they think of dentistry? You know, where is their dental IQ, so to speak? And to further that end, we conduct consumer research. We engaged a business school, rather prestigious business school, to survey the public and find out what they think is valuable about dentistry, what they don't like about it, and everything in between.
Right.
So we combine the results of that study with our own experiential track, and we use that to guide our clients' promotions.
Right. It's kind of amazing if you have hundreds of clients and you track it on a monthly basis, the data that pulls in, and if that data is organized on a spreadsheet and bounced against previous data, you can see the market shift. You can see the consumer. You can see what they care about, what they don't care about, what they are enticed by, and it's not always about price.
Right.
You can see what trips their trigger, and you can see what bores them.
Right.
Okay. So, you know, people will call us and they'll say, you know, well, what's the big deal about MPI? And I mean, there's lots of big deals, but I think really ultimately the biggest deal is all that data and all that research. It really does allow us and our design team and our deployment team to utilize the marketing budget in such a way that really eliminates almost not all the risk, because there's always risk in marketing, but a lot of it. It eliminates all that risk. When we go into a project, we look at the statistical history of the project prior to developing anything.
Right.
Okay, and for instance, if you were to log on and do a client survey right now on our website, and we were to build you a marketing plan and send it to you, part of building that marketing plan is looking at the market and looking at what should this dentist use their marketing budget for.
Right.
We can work in anything.
Right.
We have a world-class internet department. We're
Right.
well known for our mail. We have all forms of print media, television, radio. We've done it all. But does that mean you should do it all?
Right. And very, very often we'll get, well, I'd like to go into radio. Should I? Right. Well, maybe not.
Right.
You know, and are you going to do that the very first promotion that you do in your practice?
Right.
That's probably not a good idea.
Right. Could be.
Could be, but
Probably
usually
not.
it's not.
Right.
The deployment and the deployment progression of the marketing mediums is a very important factor.
Which we'll have another
And we're going to talk to you more about that later.
video on.